Abrotanum is a very valuable remedy should be more frequently used. It is indicated in such conditions as are cured by bryonia and rus tox, but its symptoms mark out its own individual cases. Rheumatic conditions with heart irritation, epistaxis, bloody urine, anxiety and trembling, when there has been a history of diarrhea. A suddenly checked diarrhea will be followed by violent cardiac symptoms. It is much like ledum, aurum, and kalmia. In marasmus of children it is a very useful remedy, and not unfrequently indicated. The emaciation begins in the lower limbs and gradually spreads upward, so that the face is the last affected, that is the opposite of lycopodium, natrum mur, and serinum. It has cured pleurisy after bryonia, which seemed indicated had failed. A woman lying in bed with dyspnea, anxiety, cold sweat, and pain in the heart was surrounded by friends to see her die. It was learned that she had suffered for many months with a rheumatism in one knee, that she had used crutches to get about the house, and that she had recently been speedily cured by a strong liniment only a few days before this attack. Abrotanum restored her to health promptly. It has caused and cured burning ulcerative pains in the stomach with suspicious vomiting. Metastasis is a marked feature in abrotanum. The changing of one so-called disease into another always calls attention to abrotanum. Inflammation of the parotid changing to testes, or mammae, is generally cured by carbo-veg or pulsatilla, but abrotanum has cured when these remedies have failed. A suddenly checked diarrhea followed by piles and acute rheumatism, with bleedings, as mentioned above, is further argument in favor of this idea. The abrotanum patient is sensitive to cold air and cold damp weather. He suffers much from backaches, and his symptoms are worse during the night. In boys it cures hydrocele. In infants it cures bleeding from the navel.